Hello, I am Dr. John Aldridge with Hampton Roads Orthopaedics. I'm an orthopedic surgeon practicing in the Hampton Roads area. I want to talk about an important but often overlooked cause of low back pain. The sacroiliac joint is located in the pelvis, linking the iliac bones to the sacrum. The sacroiliac joint is stabilized by a network of ligaments and muscles, which also limits its motion. The normal sacroiliac joint only moves a small amount. Like any other joint in the body, the sacroiliac joint can degenerate or its supporting ligaments may be injured. Common complaints of those suffering from sacroiliac joint pain include lower back pain, sensation of lower extremity numbness, tingling, weakness, pelvis or buttock pain, hip groin pain, feeling of unilateral leg instability, disturbed sleep patterns, and disturbed sitting patterns. Painful activities for patients with sacroiliac joint pain include ascending and descending stairs, transitional movements such as rising from a seated surface, rolling over in bed, getting in and out of bed or in and out of the car, sitting on the affected side, and prolonged standing or sitting. Activities that tend to relieve symptoms are bearing weight on the unaffected side, lying down on the unaffected side, or stabilization with manual or SI joint belt. Studies suggest that 15 to 30% of chronic low back pain may be from the SI joint. Other studies suggest that up to 43% of symptomatic post-lumbar fusion patients may have pain coming from the SI joint. The burden of SI joint disease is significant and is similar in terms of functional impairment to conditions such as hip osteoarthritis, lumbar stenosis, degenerative spondylolisthesis, knee osteoarthritis, and lumbar spondylosis. These common musculoskeletal conditions are often treated surgically. A thorough diagnosis must be performed to isolate the SI joint as the source of pain. This can be accomplished through patient presentation and history, physical exam including the lumbar spine, SI joint, and hip, a positive Fortin finger test, positive provocative tests, and a positive intra-articular SI joint diagnostic block. There are conservative treatment options for SI joint pain, including medications, physical therapy, SI joint injections, and radiofrequency ablation. For those patients with chronic debilitating pain who have not had relief with conservative treatment, minimally invasive SI joint fusion may be an option. At Hampton Roads Orthopaedics, we use the iFuse implant system. iFuse has a unique patented triangular shape to provide immediate stabilization and long-term fusion of the joint. The entire procedure is performed through a small incision, approximately 2 to 3 centimeters long, on the side of your buttock. Normally 3 implants will be used depending on your size. The procedure takes approximately an hour. The iFuse implant, available since 2009, is the only clinically proven SI joint fusion device with multiple prospective clinical trials, including 2 level 1 randomized controlled trials, demonstrating improved pain, patient function, and quality of life. In total, there are more than 50 peer-reviewed publications supporting positive clinical outcomes, safety, biomechanics, and the economic benefits of iFuse. In a randomized controlled trial, 80% of the patients who had the iFuse procedure with the iFuse implant met the strict success criteria, and 90% of those patients were satisfied and would have the procedure again. Long-term pain relief and improved function have been demonstrated in trials out to 5 years. SI joint disorders are a very common cause of lower back pain, but are often overlooked by many physicians. Call to schedule your evaluation today.